Childhood. Milestones. Childhood is the period during which a person is a child. It ends with puberty, the onset of sexual maturity. Infant is another word for a young child. Infancy is the period from birth until about 5 years of age. The milestone in a child's development and the ages at which they usually occur are sitting by 9 months, crawling by 12 months, first word by 18 months, walking by 18 months, talking 2-word sentences by 3 years. Common infectious diseases. Common name. Morbidity, rubella. Millets, rubella, German millet, varicella, chickenpox, infections, parotiditis, mumps, pertussis, warhead cough, acute laryngotrachis, throat, scarlet fever, rheumatic fever, tetanus, lockjaw, poliomyelitis, polio. A medical student has made some language notes while reading her textbook. Celiac disease is a disease of the small intestine caused by sensitivity to gluten. It can present at any age, but but in infancy, it appears after weaning onto cereals containing gluten. The clinical features include diarrhea, malabsorption, and failure to thrive. There may be signs of malnutrition, and there may be some abdominal distension. There is delayed growth and delayed poverty, leading to short stature in adulthood. Sensitivity to having a negative reaction to weaning, changing the diet from milk only to solid foods. Clinical features, the symptoms and signs of a disease: malabsorption, poor absorption, malnutrition, poor diet, nutrition, appetite, malnutrition. Thrive, grow strongly, distension, swelling, delay, later than expected, failure. When something that is expected does not happen, stature, size, specialized height. Okay. Chapter 18. The endocrine system. Excess and deficiency. And excess access and deficiency. And access too much or a deficiency too little of circulation hormones causes a wide range of medical conditions. For example, hyperthyroidism and hypothyroidism. When there is an excess of hormone, one form of treatment consists of giving the patient something which inhibits the production of that hormone, as in the use of carbimazole to treat hyperthyroidism. When a hormone is deficient, treatment may be by replacement therapy, For example, injections of insulin in the treatment of type 1 diabetes. Doctors say sufferers of type 1 diabetes are deficient in insulin. Negative feedback system. TRH, thyrotropin releasing hormone, is secreted in the hypothalamus and triggers the production of TSH, thyroid stimulating hormone, in the pituitary. TSH stimulates the TSH receptor in the thyroid, to increase synthesis of both T4 thyroxine in T3 triiodothyronine, and also to release stored hormone production, increase plasma levels of T4 and T3. T3 fix back on the pituitary and perhaps to hypothalamus to inhibit TRH and TSH secretion. Goitre. Okay. An enlarged thyroid gland is called a goitre. The enlargement may be diffuse, involving most of the gland, or localized, limited to a particular area, as in a solitary single nodule. The increased blood flow in diffuse enlargement, for example, in Graves' disease, may give rise to a palpable, real vibration felt with the hand and an audible bright noise heard through a stethoscope over the gland. A letter of referral. Mr. Davis' doctor has referred her to an endocrinologist. Dear doctor, I will be grateful if you... grateful. I will be grateful if you will see this 50-year-old woman who has lost 20 kilos in weight in spite of eating more than usual. She described herself as overactive, and at first she thought the weight loss was due to this. But more recently, she has developed palpitations, diarrhea, and heat intolerance. She has noticed that her hands have a tendency to shake. Her symptoms suggested hyperthyroidism, and this was confirmed by my examination, which revealed an enlarged thyroid, red sweater, pounds, and a fine tremor of the hand. Chapter 19. The eye. Parts of the eye. Eyelid, eyebrow, eyelashes, pupil, iris. Examination of the eye. Here is an extract from a textbook description of how to examine the eye. Look for a squint, strabismus, drooping of the upper lid, ptosis or oscillation of the eyes, nystagmus, in light lag, or in light lag, the upper eyelid move irregularly instead of smoothly when the patient is asked to look down. Next, examine the pupils and note whether they are equal in size, They are regular in outline, evenly circular. They are abnormally dilated, large, or contrasted, small. They react normally to light and accommodation focus on near objects. To test the reaction to accommodation, ask the patient to look into the distance, hold your finger in front of their nose, and ask the patient to look at it. The eyes should come together and converge. And the pupils should constrict as the patient looks at the finger. Check also for cataract, opacity of the lens, retinopathy. Hypertensive changes in the retina can be classified from grades 1 to 4. Grade 1, silver widening, increase in the light reflex of the arteries only. Grade 2. Grade 1 plus arteriovenous nipping, indentation of veins where they are crossed by arteries. Grade 3. Grade 2 plus flame-shaped hemorrhages and cotton wool exudates. Grade 4. Grade 3 plus papillodema.